chatting beforehand.
Yeah.
Okay, well, we got a couple of minutes, so we'll let everybody join.
Hey, good morning.
Hey, hi,
Morning,
Charlie.
A quick thing, when in looking to register for this, it's challenging to find it on the ARC website.
Under COVID updates.
Okay, but it's buried. And the only reason I found it, I found a link on Facebook with the address.
Okay, but it's not buried. If you go onto the arcofmass.org, it's the first tab you see is COVID updates. Well,
Okay.
it's home and then COVID updates.
Okay.
So yeah, the thing is you have to click on mine and Ellen's face to get the link. So that might be another stumbling
I
block.
did.
You have to kind of scroll down.
I should have done
Yeah,
that.
although Charlie, I agree that with other webinars, it is a little challenging to get, you know, like your webinar tomorrow is a little harder to find, but
Yeah.
this shouldn't be, it should be easy.
I mean, I knew what I was looking for, so but if I was not that interested, I would have said, I got other things to do instead of looking. That's all.
All right, well, I don't know how else to make it other than COVID updates and then the webinars, Leo's, Carrie's, and ours.
Maybe if you did one of those yoga poses.
Right, yeah, that'd be very distracting.
Yes.
Why do we
Hey,
have a message? Hold on.
Okay.
Admit all. Admit all. Admit all. Okay, Ellen, can I make you a co-host just in case something weird happens? And also
Yeah.
in case you can let people in while I'm talking?
Absolutely.
Okay. Did you get that?
I did. I think it's automatic. Yeah.
Okay. Okay, so I'm gonna take down my participant list. So what did I just do? Okay, sorry guys. So you'll have to watch that a little bit. I think there might be one person in there.
Yeah, I just did it. It's a little delayed, but yeah, I got Nancy.
All right, great. Okay, hi everybody. I think we probably can get started because it's 12:02, sorry. Thank you for being here. I think the last time we were all together was before the holidays, so I hope everybody had a peaceful and healthy holiday. I know it's been stressful times, so and certainly this week hasn't changed that for everyone, but I do think we have some hopeful things to talk about, and I'm excited to be here with Ellen today. And thank goodness Ellen has really been following the federal actions, and she's gonna be able to update us on that. And then of course, we'll leave plenty of time for questions. So let me, that's not what I wanted, sorry guys. I don't know why I'm struggling with my points coming up. Hold on. These Zoom things. Okay, I'm gonna start my slideshow. And just for anybody that's new, I'm Maura Sullivan. I'm the Director of Government Affairs at the ARC, and Ellen Ryan Taverna is joining me. She's our Policy Officer. And we have moved our webinars to once monthly, the first Thursday of the month. And we try to give you any updates that are going on federally and statewide. Usually it's been COVID related, but we've kind of been mixing in the typical budget cycle. And now we are going to be talking about vaccines and about our bill platform onto our agenda. You know, I think that's enough to basically take us through today. So I think I will hand it right over to Ellen so she can, does my screen sharing. Are you guys seeing the screen okay?
Yeah, I don't know if you want to set it up as a, it doesn't matter if they see the notes, it's fine, whatever.
Oh, that's weird. It says it's paused. I don't know what that means.
Okay.
Okay, well, go
Yeah,
ahead,
I'll
Ellen.
go
take
ahead.
it away.
Well, yeah, and I guess it feels strange not to talk about what happened at the Capitol yesterday. So I thought maybe we could start with that, and anybody can unmute themselves if they want to have a discussion. It was, it was very emotional to watch. Particularly, I lived in DC for almost 15 years and, visited the Capitol many times and was really horrified at what took place. Just seen many protests. That was not a protest. And so it was very alarming and scary to watch. And I'm so thankful that Congress was able to go back into the building and follow the Constitution and certify President Joe Biden and Vice President Kamala Harris last night. So, but I don't know if anybody wants to talk about what happened or, I think it was very disturbing, and I think there's a lot of discussion that needs to happen at the federal level of what's next. What will happen with President Trump, and whether looking at the security of our Capitol and of our senators and representatives, and if anybody wants to make any comments or feels like they want to talk about it and share, you're more than welcome to unmute yourself and chime in. But I can just go ahead and get started. I know Nicole, we had Nicole Jork, who's our government affairs connection for the ARC of US, and she was on with Leo on Monday. So many of you know already that the fourth COVID-19 relief package passed and was signed eventually by President Trump at the end of the year. And it did include, which the good news is, it included a 3-year extension of the Money Follows the Person program, which is funding that will help people out of institutions and community and home settings. And this took several years. We've had this extension of this program, and so it's really great to see a 3-year funding for it. However, Congress did leave out a lot of things that would have helped our community, and so we have more work to be done, particularly whether or not IRS defines adult dependents that for tax versus whether they would be included to get the stimulus payments. That's something that was not included in this last package. And so that was something that we've been advocating for all along. And it was really discouraging to see that despite bipartisan support was not included. And also whether or not tax credits to cover all caregivers, what that expired in the end of December, and that was not included in the most recent package, along with the home and community-based services funding that was not included in the package. And so that's something that we're going to be pushing for, which is in the action alert that I have at the end. We're going to be asking you to reach out to this next Congress. But I will say that there was good news coming up yesterday. Despite all the madness, we saw that Democrat Raphael Warnock won the Senate seat, and John Ossoff, both from Georgia, have now there's a split between Democrats and Republicans in the Senate, and Vice President Harris will now vote with any over any ties between votes. So the Democrats now have authority in the Senate as well as the House. And so what that means for our agenda is things like the COVID relief package that we had passed the House has a greater chance now of passing in the Senate. So these are things that we wanted that I just explained that weren't included in the last Congress will now be included in this next Congress. And so we hope to see some of our items come to fruition with this narrow majority. So the Democrats will be able to lead the Senate committees. They'll be able to call hearings. They'll be able to decide, what are the legislative priorities for the Senate. And so that's something that we didn't have before. And so that's really important. It's a narrow majority, but some really key things can still happen. And so we need our advocacy to continue and be really strong. We've been amazing during this pandemic, where we've had the voice of our community heard in Congress, and so we need that to continue. And so we asking you guys to please continue to reach out to your senators and your representatives at this time, so we can get more done for our community. And as Maura mentioned, the vaccination prioritization is really going to be important, and having like a strong federal priority in this area. So we need our voice heard. And so please, keep doing what you're doing. So that's
Thanks, Ellen.
For now. But again, if anybody wants to chime in or comment on what happened, like keep this open and have a dialogue. So we can talk now or at the end after Maura talks.
It was hard, Ellen. In the 80s and the 90s, I spent a lot of time in all of those buildings, and I saw places that I'd walked through, and I'm thinking, it's so disrespectful. That whole thing. So disrespectful.
Yeah, no, I felt the same way, Charlie. It really was. It was making me sick to my stomach to see the just total disregard for even just the Capitol building itself. Like it was shocking, those images. Yeah, it was.
And I'm sure you felt that too. Anytime I was there, and I spent a lot of time there, I always would stand back and realize where I was in the house that we all own in a nice kind of way, and seeing it being trashed by people. It became personal when I saw that. It just wrong.
Yeah, it was truly horrifying.
Ellen, this is Mike Maloney. I also lived in DC at one point, and just tons of young people trying to do the right thing every day. But I just saw, and you probably saw it as well, Mark Zuckerberg has cut the president off from Facebook and Instagram for 2 weeks. And I don't think Section 25 or Amendment, what is it called? Amendment 25 to the Constitution. Chuck Schumer's calling for it. Yeah, I don't think that's going to happen, but hopefully we'll have a relatively quiet 13 days, but I'm not sure.
I know. I don't know what would really work. I do, you're right. There's only 13 days, but it could prevent him from, taking office again. So
right.
It might be the right thing to do. But again, this is up for debate. And obviously, the ARC's a bipartisan organization, so we're trying to stay neutral. But yeah, that's right. I mean, that's, but I did see that as well about Facebook, and I guess that applies to Instagram. But we'll see if Twitter follows suit too. I know. I think he's back up on Twitter now. I don't know, but
I heard that Mike Pence unfollowed him, which was.
Oh, I didn't hear that.
Maybe it was a rumor, but that's what I heard.
Oh, boy.
Well, putting that aside, Ellen, I think maybe at our next update, which would be February. Oh, let me let Ashley in. Maybe we could take a look at Biden's disability platform and kind of see, what he has right now and where we can, make a difference in terms of our advocacy with our Congress people.
Yeah, I think for now, at least what's up, the ARC of US is pushing what, what they wanted in the COVID relief package. That's,
Oh yeah, I mean, COVID will take
priority. I think that's, COVID's going to take priority for a while, but you're absolutely right. That's a good idea to look for the long term, what the administration can do. For sure.
And I know he adopted a lot of Warren's policies, which hopefully is a good thing. So maybe we can look at those. But okay, well, let's move on since we have a lot of other stuff to. Oh, I was supposed to put that up while you were talking. I'm sorry. It's a horrible photo. I mean, really, we can come back to it at the end just to get the reality of what truly happened. Look at that photo. Amazing. Okay, so let's talk a little bit about the vaccine deployment that is underway. And if people haven't seen, on Monday, they posted I think it was Monday, but it's up there now, the vaccine dashboard. I mean, it's interesting to look at. You get to see, what's come into the state, how it's been dispersed, and then what the actual administration numbers have been. And obviously these are all hospitals that are getting the large amounts of these. But I think what's also interesting, and then I got put it, down a little bit lower there, is that sometimes the hospitals are not able to actually utilize the Pfizer doses in time because they are, they have expiration, and because of this deep refrigeration need. So if you're hearing that people who are not necessarily frontline healthcare workers, or maybe they're community healthcare workers, and they've been able to get their vaccinations, a lot of that is hospitals kind of reaching out to their community contacts and saying, we either have to dump 100 vaccines, or let's, use them, bring your folks in. So, so I think that gets the rumor mill going, that like, oh, well, such and such in a community-based program got their, vaccine. So I think the logistics are really hard with the expirations and the refrigeration. So just keeping that in mind. The other good news is that people over 75 and with 2 comorbidities are coming right up at the top of phase 2. And we are, really recommending, obviously, that everyone that has an intellectual or developmental disability is seeing that as a comorbidity. So although we have not heard back around day programs, and we're still struggling with group homes and residential programs, I do think this gives us a little safety net that there will be a lot of folks that will be covered under the 2 comorbidities. And I think at this point, the 2 comorbidities is actually done through your primary care doctor. And then I will say that all of this is in constant flux. So things we talk about today could change this afternoon at 2:30, because there's another meeting going on at 2:30 to kind of discuss the deployment as well. I think I have it on there. It's a congregate care webinar.
Maura, can I ask a question?
Yes.
I just saw that it was that Down syndrome was added to the CDC's list of conditions that are more likely to be negatively impacted by COVID. And I was wondering, do we have any say on like including other developmental disabilities?
Well, in particular, I don't think the CDC doing that has changed anything in Massachusetts at this point. But certainly, if people with Down syndrome and other intellectual developmental disabilities are in a congregate setting, and then as a comorbidity, I think it definitely raises them up. But if you take a look at, I'll push to the next slide, our update. So we did a little vaccine update, and we actually link to many articles that support people with IDD being prioritized. And of course, all of our letters to the state have definitely pushed for prioritization of those with Down syndrome, autism, intellectual and developmental disabilities. Based on the research, obviously, that's already been done. So I was glad to see that in the CDC. And, maybe it will eventually help states. But right now, I don't think we're making changes based on that.
Nice, thanks.
Okay. So if you haven't seen this letter, it's helpful, although probably will be outdated pretty quickly. But there's the link and you'll get this, but you can also find it right on our ARC website, right under COVID updates. And the other thing to just let you know is our letter. At this point, we haven't heard anything back. We did a letter from the ARC and the DLC, and then another dozen or more organizations signed on, as well as hundreds of individuals, talking about the need for staff and clients at day programs to also be prioritized. So we're still pushing that, still asking for response. Whoops, let's go back one more to this one. So I know in the congregate care settings, things are really feeling inequitable and confusing. And I know we have Mike on the call, but there might be some other providers who, if for people that don't know the process, there's a matching process that goes on where the group homes are matched to a pharmacy, and some have been matched and some have not been matched. I don't know, Mike, did you want to talk a little bit about HMEA's matching and how that's going?
Yeah, so originally on the original spreadsheet, we were not matched. But we are now with CVS, and we have 2 solid dates and perhaps another. And I'm kind of encouraged. I thought it was going to be more spotty. We'll see how it goes. But I think we have 2 6-hour blocks with CVS. And so we're hoping to get as many folks as we can, staff and people we support. And then I think there's a third in the works as well. Not exactly sure how it's going to happen or anything like that. We're also working with vaccine hesitancy on the part of some of our staff, right?
Sure.
Yeah, not everybody wants to get vaccinated right out of the gate, so that's going to be interesting.
One
Definitely.
question I would have is, do the people at CVS who would be administering the vaccines, do they know are they trained in like how to interact with people with disabilities?
Yeah, see, we will have our staff with them, and I think we'll have nurses as well. So even though they may not have the experience, we'll be right there.
I see.
And most of the folks we support get the flu shot right now, so probably they won't discriminate, except this has to happen twice, right?
Yeah.
And that's the other logistical nightmare is the double dosing and the scheduling for all you guys. I mean, even hospital systems that have all of their employees right there are struggling with the scheduling. And so I can't imagine how tricky it's going to be out in the community to get this right. But I think everyone has to have patience, and yeah, thank goodness for our workforce, because they're going to be there to make sure that the people with the disabilities are safely given their vaccines. So that's great. So hopefully we'll learn a little bit more. I guess yesterday there was some changes or clarification with Mass Health Home Health, and originally PCAs had been prioritized in phase 1. But again, there was very little information out there specific to how these PCAs would get vaccinated. So we're still waiting on more specifics, but it seems as though Mass Health is saying DDS is going to support family support in the home caregivers, family support caregivers that go to the home health, and additional people that are in the homes. So I think that's good news, although once again, we're waiting for clarity on that. So that, I think that covers the vaccine update, and yeah, we're at 20 past, and I left this slide in from last time because this is where we were on the beginning of December, and this is where we are again, because at this point, the police, back in December, the police reform legislation was on the governor's desk, and then he sent it back to the House and the Senate, and they had to renegotiate it, and then they did that, and then they sent it back. So we're back waiting for him to sign this piece of legislation so that we can be sure and be certain that our police training has passed for the year, because otherwise it would change how we go forward, obviously, with our bill platform. But we're feeling really good about the fact that he's going to sign that soon. So because of the timing, we thought it would be really important to talk about our bill platform. Sorry, I'm letting people in here. But we got some really good news yesterday, which is that there was an extension on the filing date. So I think it was really important because legislators were working right up until Tuesday for the end of the session. And this was the end of the formal session. So they were at the State House till 3 a.m. or past that. But regardless, they just haven't had much time to really work on putting together their bill platforms, and also just working in the COVID legislation that many constituents are bringing forward, and trying to figure out the best way to put what needs to be put in legislation forward. So that helps us too, because we can work further with educating our legislators, our new legislators, around our bill platform. And when we finally file, we'll be able to collect those co-sponsors that we're always looking for every year, every 2 years. So once again, we have 18 bills, 5 priorities. These priorities can definitely shift as this session goes forward and after hearings. And if a bill moves out of committee that seems to have some juice and some movement, then it may move up our priority list. We're including training bills as priority, safety, education, housing, workforce, access to services, and policy and disability rights. And that kind of hits on a wide range, although there are some areas of gaps, and I will never say that we don't add bills as we go when we need to, and we can also file late bills. So language. So right now we're in the process of actually coming up with language for our new bills, or changing language in some of our old bills, beginning to educate co-sponsors, and getting new sponsorship where needed. We had some people retire or leave the legislature, and also looking at the challenges for our legislation and the opportunities given COVID. So some of our legislation kind of popped up this year as extra important, and you guys heard me talk about it a lot in terms of our healthcare bills, and they are going to continue to be high priority on our platform. So just to let you know about our new legislation, we are planning on expanding the abuse registry, so expanding Nikki's Law, Dana's Law. And we're in the process of actually getting the language down for that, and the scope of that bill, and what we think would be able to be managed capacity-wise by the DPPC as we move forward. So actually having a meeting today with the DLC and some of our sponsors. So more news on that to come. And again, expanded police training, as long as our police training bill goes through, that's in the police reform bill. We will look to expand police training to existing police officers. I think you've heard me say that a few times. So Tommy's Law is a new bill for us, and this bill is relative to safety in our group homes, and relative to medical equipment monitoring. And I will tell you a lot more about this bill, and I might actually have the bill sponsor come on at some point, since it is a new bill, to tell everyone a little bit more about the importance of it. But really what it's looking to do is not leave important medical monitoring and discharge planning and treatment planning to those who are non-clinical people. So, the problems we were having is direct support staff who were, very entry level, were having responsibilities of maintaining medical equipment that was life-saving. So we want to elevate that. And so we think it has a really good chance of passing this session. And I will share all the bill numbers and all the sponsors and all the information as soon as we pull it all together. And then some of you have been interested in the Fernald State Memorial or Museum legislation, and that is coming together. We have a great vision statement that's going to be kind of transferred into legislation, and really relieved that we have a little extra time for the bill filing on this one. This was definitely a last minute bill for us. So stay tuned on that one. And again, refiling of our healthcare bills, that's hospital training, and so important this year when we saw what happened for people with disabilities who did not have the accommodations or supports they needed during COVID, the bias and discrimination that we all saw across the state and nation. So those bills will continue to be priorities. We do need to prioritize the Disabled Persons Protection Commission's bill. because without that bill through, Nikki's Law, Dana's Law will have a really hard time implementing and being a legally sound process without this regulatory bill passed. So it jumps up to our top priority as well. The other bills, I won't go into everything, but you will be able to see our entire platform. And if anybody has any interest in supporting any bill on our platform personally, reaching out to your legislator, because this makes a difference to you, or you have a loved one who's hoping to get into the Macy program or needs ABA or any of these, the housing bill I know was extremely important. And just a quick note on accessory dwelling units, because the economic reform bill passed, or it's not reform, economic bill passed through at the last minute, like a couple days ago. We do think that with that bill passed, our sponsors feeling more positive about accessory dwelling units potentially getting through this year. So fingers crossed, but it's been many sessions for this bill, so we really gotta find a way. So I think there's still a lot more bills on our platform that we can talk about, but again, contact me directly, and if there's bills that are super interesting to you. And then I thought I would just end with the happy news that Ellen mentioned earlier, and just kind of let it sit up there, and then we could take some questions. So sorry, I went through the bills pretty fast, but there's just so many of them, and right now we're really at that point where we're still putting it all together. But does anyone have any questions? Ellen, anything else to add?
No, I mean, I looked in the chat. It looks like the question was answered. I mean, about the uprising in other states, and there was a few, I think, in Georgia and Michigan and in Washington as well, but nothing like what happened in DC. Seemed like they had at least more security in Michigan than they did in the actual Capitol in DC. Yeah, I don't really have anything else to add, I think, unless anybody wants to talk more about it. But you're right. I mean, we've got, the Democrats have control, so we've got opportunities to really make a huge difference at the federal level. So.
Yeah, and thank you, Beth, for adding the Disability Scoops article on Down syndrome risk. It's a really good one. 10 times more likely, to die or have really negative effects of the disease. So it's really good for people to get that out there, share it. The more we can advocate for that, the better. All right, well, thank you, everybody. We're ending right on time today. And I hope by February, we'll have some good news to share, and the vaccinations will be going strong. And I hope everybody stays safe.
Thank you.
Thanks.
Yes, thank you.
Thank
Thanks,
you.
everybody. Take care.
All right, take care.
Bye.